You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture On Air program. Our pleasure, as always, to have in the studio Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, Ken, and you? You're getting that washing off the frost off the morning in the car, are you?
I know. Tell you what, though, it has been colder. I can remember in the good old days, I used to live in England, where you're washing on the line. If you left it out overnight, it was solid. So a shirt was, that was it. It was in the shape of a shirt. It's not quite so bad over here, but it has been cold, hasn't it?
Yeah, but I always find that August, for me anyway, in here in the Bay, tends to be the colder month or the more miserable month, if you like.
Indeed. And look, we're just a month away from spring.
Yeah.
And we've got through it. We live in a paradise, don't we?
Yeah, well, I'm off to Wellington in a couple of weeks, so that's going to be a good test for me for New Zealand winter.
I love Wellington. You can't go past it, apart from the wind and the rain. It's great. Anyway, just remind our listeners, we want to come and see you for some acupuncture, some moxibustion or some Chinese herbs. Where are you?
I'm in 206 Charles Street, Hastings, and go to my website, which is acu123.co.nz.
And you're famous. You're on YouTube as well.
Yeah, and we're getting a lot more views and hits, whatever the word is, and comments. So yeah, that's looking quite good. A nice way to promote all the information about what acupuncture can do.
And it can do everything.
Pretty well so, everything, and which it's taken some time for you to realise that, but yeah, we're getting there. And today's is no different. When we're talking about today, polymyalgia. So then, and of course, you'd know all about it and sort of what it is. And
well, to be honest, when I read your notes, it's the first time I really heard about it, because last time we spoke about fibromyalgia.
Yeah. There's lots of algas around, isn't there? Yeah,
that's right. So what is polymyalgia?
Yeah, well, first let me say it's technically a new disease, meaning that it was first sort of classified, say, like in 1966, which I looked up. Whereas other diseases, something like multiple sclerosis, they've already been like classified and looked at maybe even more than 100 years ago. And again, with this condition, there's no like definitive blood test or something that can do, but it's predominantly they have a pain symptoms in the upper body.
Yep.
Sort of the neck, top, the shoulders, and that, and it can be associated with another condition that they call temporal arthritis, where you get sort of arthritis up here in the temple regions.
So what causes it?
And again, it's one of these things where they're not sure. In fact, they don't know. Some suggest it could be viral, it could be bacterial. To confuse the matter, sometimes the condition just gets better of its own without doing anything, and other times it's it can be longer lasting and be debilitating. And the basic treatment that Western medicine would do is steroids. Mm-hmm.
All right, talk us through the symptoms. So you wake up in the morning, what happens? Yeah,
well, the thing is that one of the other, and what they would say is a keynote symptom is fatigue and tiredness, and then with that is also then the mental things such as depression or difficult to concentrate and things like that. But it's hard to sort of say are they just tired and feeling miserable because they're in pain, or is that part of that whole picture?
Yeah.
The other important symptom that's noted in the sort of Western medical term is that the patients have like an ongoing, constant flu-like feeling. Now, this is important in terms of Chinese medicine because it helps with our sort of like like diagnosis and the treatment principles according to it.
So, what do the Chinese think cause polymyalgia?
Again, so we don't have there is a translated term for the modern word polymyalgia, but a traditional medicine would look at the symptoms that the patient is experiencing. So would come in and say, okay, well, Western medicine has called it this, that's fine, but how are you feeling? What have you got?
Yeah.
And then they'll start saying, well, I've got these pains here, and I've got this, and then I feel tired, and then I feel this, and then I always feel like I've got a flu, but I haven't really got one, and this is quite an important sign for us, because in Chinese medicine we talk about latent pathogens, which is sort of like in Western science, it's like a sleeping virus or a sleeping bug, and it's like you've got a little bit of a virus in you. And we know, like, if you have hepatitis, eventually it can damage the liver and cause all sorts of serious adverse effects. But then there are other viruses that just sort of like and often they haven't been found or discovered, but they suspect that they're there, and it's causing you to feel fluey, feel tired, feel achy, feel miserable. Mild fevers going up and down, coming and going for no reason, but they can't find anything. In our Chinese medicine, we would call this like a latent pathogen. So then we have sort of treatment strategies to expel these pathogens. And it might be that we use medicines to sweat out the bug. Mm-hmm. It might be that we urinate them out, purge them out. And so that then the bug itself is eliminated from the body, and then part of our strategy is to build up the Zheng Qi, which loosely translates as your good or your fighting energy, or your constitutional reserves. And so then we use another treatment strategy with acupuncture or herbs to build up this good energy again.
One question I was going to ask you was that who determines what it's caused? What it's called? I mean, if I come and see you and I haven't been to my doctor, my doctor might say, "Oh, yeah, you've got polymyalgia." Yeah. Now you're not a doctor, but when I come to you, I'm going to say, "Oh, I've got all these symptoms." Yeah. And are you going to say, "Oh, well, sounds like you've got polymyalgia"?
What I try to emphasise, these are terms and these are names, and be it that the medical fraternity has agreed and said, okay, well, if you got these bunch of symptoms, then we'll let you. We've decided we're going to call it this. Yeah. And one of the examples I always use is irritable bowel syndrome, and because fundamentally what irritable bowel syndrome is alternating constipation and diarrhea with lower abdominal pain, and they don't know what causes it. And that's the bottom line. Like if they've done all the tests and they haven't found that it's a tumour or a virus or something that they can measure in a blood test, then okay, it'll get lumbered. Yeah, so we just like to put a name on it. We've got to have a name for it. Yeah. Whereas you wouldn't worry about a name. You just treat the body. And then because if you said to your patient, you said, that's right, you've got alternating constipation and diarrhea with low abdominal pain. Yeah. And the patient will go, well, I know that. Yeah, that's right. And then say, but now we're going to call it irritable bowel syndrome. Yeah. Oh, okay, that's good. So I feel better because you've called it something. I mean, we can be cynical about this, but that is the reality. That's the truth, absolutely right. And some of these, like polymyalgia and fibromyalgia, I mean, a lot of their symptoms, they will overlap, and that's why sometimes the physician might say, well, I think it's actually more fibromyalgia than polymyalgia. Yeah. And then someone says, no, it's definitely polymyalgia. And you think, okay, well, if it's definitely that, well, then we'll do something about it. Oh, well, we can't really do anything about it. We don't know what it is? Yeah. Okay, well, let's presume that we do know what it is. I come to you, I want some treatment. What sort of treatment are you going to give me? Again, a mix of acupuncture, and that will include the moxibustion. Yep. And again, you have that option to do Chinese herbs as well, because they're working on the same principles. One of the things with polymyalgia is that because it's pains and aches in the muscles, right? Chinese medicine has a simple view that the spleen controls the muscles of the body, and so that if the spleen is weak in some way, and with the spleen being weak, one of the keynote symptoms is tiredness, is difficult to think, concentrate, foggy head, which are some of the other symptoms that polymyalgia people will get, plus the aches in the muscles. So we need to work on the spleen. And then we say when the spleen is weak, we say that damp can build up. And this sort of equates to like the water metabolism, the fluid in the body are not moving properly. Water accumulates like water in a sponge, sits there in the muscles, gives you an ache, gives you pain. Yeah. And so then we have treatment strategies to, move the damp, strengthen the spleen, improve the muscles, and then, as I mentioned before, to expel the pathogens. Yeah. Okay, so how are you going to do that? You're going to give me the needle, or you're going to give me the Chinese herbs, or you're going to give me the moxibustion, or you're going to give me the whole lot? Again, that's up to the Chinese medicine practitioner. I can't sort of comment and say one is better than the other, because I'm trained in Chinese herbs, so then I would tend to want to use Chinese herbs as well. But you can just use the acupuncture, and I would certainly be advocating the use of moxibustion, particularly in the polymyalgia cases where we were saying is that part of this, where these pains are, there's the the blockage or the excess pathogen, if you like, is there.
Yeah.
So we use what we call like a direct moxibustion, like little cones of moxa right onto those painful points. We light that, and then it burns down, and before it reaches the skin, it has like a warmth feeling, and then you take it off as if you're trying to drag out the excess condition, or drag out the bug, if you like.
What would be the Western practitioner of medicine? What would they treat it with? Would they give you antibiotics or?
No, the main treatment is different types of painkillers and also steroids. And again, it's not actually that successful. That's usually why patients will end up coming to an acupuncturist or to a herbalist, or going to the health foods, or try to find some other kind of cause to treat it, some other thing to treat it.
The way you've described it would appear to me as a layman that I've got aching muscles, I've got flu-like symptoms, hot spa, couple of days in bed, rides rain. not the case?
No, and it's not that, because we say like that latent pain, they're deep inside the body and they're sitting there. It's like a sleeping virus.
Yeah.
And be it, having a good hot bath in a day, you might make you feel a bit better. It doesn't actually expel the bug, so to say. If you just get an acute bug, like from a staph infection or something, you can get over them quite quickly, quite a few days. But I think there are other bugs, whatever, that are more resilient and stronger. They sit deeply, and for want of a better Chinese medicine, so they wake up and go back to sleep. So that's where symptoms come on and symptoms go off, symptoms go on, symptoms come off. And one of the strategies that Chinese medicine is quite different to, say, a modern herbalist or maybe a naturopathic view, is they'll want to give tonics. So we want to give everything to make the body stronger. So we'll give them ginseng, and we'll give them vitamins, and have carrot juice extracts and all these things. But from our point of view, all you're doing is giving the bug more nutrition to be stronger.
Yeah. Sounds like an ongoing thing. The treatment that you're going to give someone, is that going to just mask the problem, make you feel a bit better, or is it going to cure the problem, or is it a long-term thing that you can't say, well, we're going to get rid of this for you?
No, that's why I feel much more confident with the Chinese medicine approach. Is we're actually expelling
You're actually getting rid of it.
Yeah, expelling the bug per se, and we're strengthening. One of the better, it might be the immune system, or just your general health, your general fighting ability. And the word we use is the Zheng Qi, which I said it loosely translates as your correct, good fighting energy. We get that stronger to push out the bad stuff. Whereas a Western medical type approach is really just to suppress it with steroids, and wait for it to come back again, and then try to suppress it again.
My old granny would have said, a nice hot toddy, some whiskey, some hot water, some lemon and sugar, and you're going to be right as rain.
and the fact is that there's some actually truth in that old sort of what your grandmother used to say, but that'll particularly, I think, be more useful in an acute type of thing, but not for the chronic ones.
Okay. All right, we're just about out of time, so we want to come and see you about polymyalgia, or in fact anything else that's wrong with us, because according to you, Heiko, acupuncture is the name of the game. How do we do that? Where are you?
Well, I just say acupuncture, I think, is the name of the game. I think that the recent information that I've found out is that there's now, I think 30,000 something or other research projects that have been done on acupuncture, so it's now superseded physiotherapy and many other therapies. So it's on the rise, and more people are taking notice.
Yes.
But then again, it still doesn't matter what happens. The skeptics still get a bit fussy about it.
Yeah.
And with that, we're going to finish with our song. I'm going to put my website and thing onto the comment section on the YouTube. You can have a look and contact me there. But the song that we've got, the song is Hey Negrita by the Rolling Stones.
And who wouldn't know that song?
Yeah, isn't it amazing?
Here it is.